Just for reference, this video is being shot on 9th of August 2020. I am Dr. Srihari Kulkarni. I am an internal medicine resident working in Bangalore. We all know the situation we are in right now. The global pandemic has taken a lot of lives. As of today, there are about 6 lakh cases of active infections of COVID in India alone. And yet, the numbers are not going down. The numbers are actually rising day by day. There is a lot of misconception being spread on WhatsApp, Facebook, and other such social media. I do not want to talk about those things in this video, but I'd like to give you a few very important tips and facts regarding what is happening with the COVID right now. To start with, COVID-19 or SARS-CoV-2 is an actual virus. It is not a bacteria, it is not a hoax, it is not a myth. It is an actual virus that has been infecting humans. And secondly, as of this day, we do not have any proper medications that are targeted specifically for COVID-2 infections. That means there are no specific vaccines available, or we do not have any specific antivirals that are targeted only towards this particular infection. The only antivirals available to us today are targeted towards other viruses as well. So it is not a specific one, instead it is a broader antiviral that we have. So it is important to understand that prevention is better than cure in this particular disease. And there are a few ways of preventing COVID infections. We all know each and every way of it, but we need to understand why we need to do it. The problem is not with the elderly. They are sane enough and they understand the real situation that we are facing right now. The problem is with the youngsters who feel that they are very strong and they are immune to the infections. Agreed, the mortality rate in youngsters is much less compared to the mortality rate in the elderly. But we youngsters are the carriers for these infections. It is not the elderly who go outside and who go out to play, who go out to work, or who go out to eat and chill. It is us youngsters who go out and take the infections home when we come back. So there are a couple of ways of preventing the infections. That is, wearing masks all the time when you interact with people, proper hand hygiene and washing your hands frequently, especially when you go out and come home, maintaining a distance of at least 6 feet from people, and isolating yourself if you experience any symptoms of COVID. You need to understand why we need to do this. There is a concept called flattening the curve. I will try to explain this in a very simple way. Imagine your city, the city that you live in, has 1 lakh people, and the city has around 200 beds or 200 hospital beds. Imagine if all the 1 lakh people of the city decide that they do not want to follow all these rules and they don't mind getting the infection. We all know the current mortality rate is around 2 to 3% depending on where you live. So that means for every 100 people who get infected, 2 to 3 people die on an average. That means for a total population of 1 lakh people, there will be 2,000 deaths. This assumes that everybody gets the hospital care. Now imagine all the 1 lakh people start going out and all of them get infected in a very short span of, let us say, 1 month. Since the number of hospital beds are finite, that is, the number of hospital beds are just 200, we won't have enough beds to cater to all the patients. And hence, we won't have enough ICUs or enough observation to all the patients, and we won't have enough healthcare personnel taking care of each and every patient who is infected. That means there is a higher chance of everybody getting infected and more people dying of not getting the proper care required rather than the disease itself. But let us say if all of them understand the importance of the social distancing and hand sanitization and all these things, and all of them promptly follow. The rate at which people get infected will be very slow. Say for example, there will just be 20 new cases every day. So the number of people who get the infection is just 20 and there are 200 beds available. So we will be easily able to manage all the cases. This does not mean that the mortality rate will be zero. All that this means is that the people dying of not getting proper hospitalization and proper hospital care will be very less. So it is very important to understand that if you as an individual start to care about your personal health, it means a lot for others who are at a very high risk of infection and mortality. If you find a claim or a cure for COVID infection on WhatsApp or Facebook or any such social media, stop for a moment and think if the content is actually true. If it is really true, it will come in the newspapers or also in the news channels. There are two important websites where you can get all the information about COVID infections from. They are the WHO website and the Indian Council of Medical Research or ICMR website. Please understand that as of now, COVID-19 is an infection that can only be dealt with if all of us decide to stop the infection from spreading. If this video makes sense to you, kindly share this video to others. It is for our own good, because united we stand and divided we fall. Thank you.